All right, Dr. Emer, you're live.
Hey guys, it's Dr. Emer. We're in West Hollywood and it's Filler Friday. But this time we're talking about filling the buttock because we're doing non-surgical buttock augmentation. You know, we were in the operating room this morning. We did fat injections to build the buttock. But here we now are in the clinic using Sculptra to build the butt. And my patient here is very athletic, super lean, super trim. She looks great. But she wants to do some stuff to keep her a little perky and have a nice athletic shape to her butt. So if you look at Sculptra, you can see it here. It's diluted in the solution. There's little particles in there. And when they go into the skin, they build collagen over time. The key for her is to really keep her lifted. So we're focusing on the vials being up top. And it's going to look over fluidy right now. It's going to look a little larger. And then we're going to massage that in. And then it will build. The other thing is squeeze your butt as hard as you can. When women squeeze in, and she has a nice little lifting here, but there's a little hip dip. So you also want to put a little bit of the Sculptra laterally to get a nice lift so that you have this arch that occurs. So as she works out with her normal routine, she'll get a nice improvement. The Sculptra is diluted. It has numbing inside. Okay, good. Best you can be. Deep breaths. Any questions there?
No, how often can you get Sculptra?
I mean, technically you could do this every couple weeks if you wanted, but Sculptra builds over the course of 2 to 3 years. So it's best to do this, you okay? It's best to do this every few months, initially maybe a month apart, and then every quarter or something like that to just keep it building. And do little injections over time. So far, she's so good. Deep breath. Again, we're building the top part of her buttock the best that we can. So do you want to give her a squeezy ball?
Here's a little squeezy. Doesn't
Oh, sorry. Who's behind me? I didn't know who was behind me. Sorry. Did you want to tell me this? The phone person. You're doing really good. Deep breath. So you see how it's going to be over accentuated right now because the fluid's going to all go down. And it's going to dissolve into the skin and the muscle here.
And I know we're supposed to massage it even after treatment.
Yep, like we massage a little right now. And that's going to press that in there. Go ahead. Hold on. Squeeze again your buttock for me. Good. We're going to do a little bit more into the dip. Just a slight bit. Deep breath.
How often should the patient massage?
Well, in the old days, we used to tell people to do 5 minutes, 5 times a day to each area. But to be honest, with the dilution we have now, you don't really need to. You do once or twice a day for a couple days and that's it. I just tell people go work out, start working out. That's going to be the key, is exercise. You want to stimulate the Sculptra to kick in. So if you can, exercise right away. But it really does work. It just takes a number of vials over time. Squeeze again. Okay, relax. Almost there. Should be kind of numb. I hope. Good. Deep breath. There you go. Good. Almost done. You guys see the fluids going in there. Perfect.
That's what it is.
And just do a light massage. One more, last one. Squeeze again. So I'm focusing on building her up top. Good. She's gonna do great.
Somebody saying that they love you.
Me or the patient? We love you guys. Thank you for following. So take a look. Right now you can see she has a nice buttock, but we're trying to get it to lift up and kind of fill out a little bit. I'm going to switch to the opposite side. Turn it over this way. Perfect. And we're going to let that sit. Then what we're going to do right afterwards is we're going to do a treatment of True Sculpt Flex, which is a muscle toning treatment, which will help lift the buttock and stimulate the Sculptra. So now deep breaths, because I know you don't have numbing in here yet. Perfect.
Isn't True Sculpt Flex a new treatment?
It is. True Sculpt Flex is the newest muscle toning device. It's double the results of M-Sculpt in terms of muscle toning. And the one cool thing about it, besides that you can treat numerous areas at once, and not only does it stimulate the muscle, it actually twists the muscle. So it's like actually working out. It's truly like a real workout. And so we're going to do a little muscle toning in her buttock and her thigh. It's going to be great. And it will stimulate the Sculptra, and she'll get a lot more out of it. And then again, we're going to go a little laterally as well. Now, I don't like to use a really big needle. Some people inject this with a really large needle. And yes, it's less needle pokes, but people bruise a lot, and it's very painful. At least with this, you don't nearly bruise as much. And so it takes a little longer to do, but it's just better for my patient.
How much Sculptra are you using?
We're using 8 vials right now. Right?
Yes.
So I thought it's a good amount. I think athletic people do really well with like 4 to 6 aside every quarter. I think it really works well. I've been doing that for many, many years, and my fit patients continue to have a boosting. Now that we have these muscle toning devices, I think you can get even more out of it. Before, all we had was straight radio frequency, which I think tightened the skin but didn't really lift the buttock. Now with their toning, with the muscle toning, you really can lift the buttock. I'll teach everybody about flex when we do that as well. Squeeze, good, squeeze. Okay, relax, good, little pinch. Good.
Why do you ask her to squeeze?
Because I want to see where the muscle is, and I really want to see where her muscle perks up the most so that we can make the Sculptra work better, work more there, concentrate it. Squeeze it again. See, like the nice roundness there, relax, perfect. Now the cool thing when we do True Sculpt is she'll actually feel it tighten immediately. So it'll be really interesting to see what she thinks. Squeeze again, relax, good. Almost done. Squeeze it, squeeze again. Good, relax, perfect.
What dilution do you use?
We do 30 cc's typically for a body Sculptra. Most people's standard for face is about 8 to 10 cc's, and for body it can range. Been doing this a very long time. If you do the 30, it's very safe, and people get really good result. And I like safe and reliable. We do this with Selfina, we do this with our body treatments. Squeeze again, relax. Last one. Good. Good. So now what I'm going to do, a little cleaning and a light massage, and then we will start the true sculpt. I'm going to show you guys, if we look from the back, this is what you eventually could get to. This is over accentuated because of the fluid, but this is where she's going to get a lot of lifting at the top and laterally. So we just massage that in a little bit, just to make sure it's nice and even. Perfect. And then we're gonna layer it down. That's non-surgical buttock augmentation. All right.